I am actually a native of Greensboro, North Carolina. Graduated from the University of North Carolina for my undergraduate training, did graduate work at Yale University, and then went on to the Chicago Medical School for my medical education. I got interested in phlebology really because during my prior life as an internist, I saw so many patients that had problems with swollen legs, varicose veins, ulcers in their legs, and really didn't have a good way to treat them. And over time, reading journals and going to some meetings, I really started to learn about that there was a whole nother world of phlebology out there where really something could be done for these patients, and got excited about that and really wanted to become a part of it.
I'm a physician originally from San Diego. I did my undergraduate at UCLA and got a bachelor's degree in mass communications, and then moved to Chicago, had my medical training at the University of Health Sciences Chicago Medical School. Served as a chief resident at Rush Presbyterian St. Luke's, and then went back to Southern California and practiced family medicine for about 11 years. During that time I did some aesthetic medicine training and got into the specialty of phlebology, of vein treatments, about 5 years ago. I practiced with and got training by one of the former presidents of the American College of Phlebology, Helene Fronick, and worked alongside her for about 2 to 3 years, and then decided to move to Greensboro because Dr. Krusch has a national expertise in phlebology.
My background's in family medicine. I trained in medical school at Duke University and then did my residency in family medicine. Practiced family medicine for about 10 years and really developed an interest in venous disease, seeing a lot of patients with vein disease in this area. And went back and did some additional training, some of the outstanding phlebologists in the country, and have been now practicing phlebology myself for a little over 8 years. The things we really enjoy about phlebology here is just seeing our patients progress through the treatment process, seeing the improvement that they feel in leg discomfort that they've been experiencing for a number of years, and seeing them go through the process and being able to continue their routine activities and really having a significant improvement in their quality of life.
There's been incredible advances in technology. Years ago, if you had varicose vein disease or bulging varicose veins, the only option you really had was to have your veins stripped. And the trauma associated with that, the recovery period, and also the use of general anesthesia really was a problem for patients. With the advent of the endovenous catheter procedures, things like EVLT, laser catheters, radiofrequency catheters, the closure procedure, all of those have really just changed the entire dynamic how we approach the treatment of vein disease.
The doctors have worked very hard to get the very best, most state-of-the-art equipment here.
The center's outstanding. It has a multidisciplinary approach to treating leg veins. We do full diagnostic workup as well as treatments here, and sort of have backgrounds in primary care, internal medicine, and family medicine, so we understand the need for patients to be able to not only get the best workup and treatment, but also be able to fit it into their lifestyles.
Well, I think one of the nicest things about our office is it's just a very open and cheery place. Our staff is very experienced. Everybody here is dedicated to the practice of phlebology and has been that way for a number of years.
Their experience here will be second to none. This is a brand new facility, state of the art.
I think the biggest thing that separates us from other practices that may offer treatment of some vein disorders is that we really look at the entire spectrum of vein disease. We treat patients that have cosmetic spider veins that they don't like, and then we treat patients that have venous stasis ulcers from long-standing venous insufficiency. So we really cover the full range of vein problems.
Phlebology is the only thing that we do in our practice. We're not divided in our attention in terms of our education or our research or in what we do on a day-to-day basis. So we're very focused on what the newest techniques are for patients and for where they're going to get the best outcomes.
Dr. Featherston did some sclerotherapy on me. I developed some spider veins during pregnancy, and so had some treatment on those spider veins after having delivered, and just have been really, really pleased with the results.
Because of the standards of care that we've achieved here, people can do this without almost no downtime. They can go to work, go on with their normal daily lives, take care of their families, and get great results, and finally be pain-free.
We're fortunate to have a very, very nice staff here. Dr. Krusch, myself, got to know each other 4 or 5 years ago, and now been in practice together for a couple of years, and it's just been a great association. We have a very similar thought process about what makes a good practice and how to take care of patients. And we're really excited to have Dr. Greenberg. Has been with us just for a few months, but he's got a lot of experience in phlebology, brings a fresh perspective and some slightly different training. So we feel like we've got a wonderful staff that really gives a lot of nice alternatives for patients.
Well, ideally what we want the patient to do is have a very relaxing and not a lot of pressure on them through the process. They come in, they will initially come and have a consultation with one of our doctors. After that, they'll probably have a ultrasound scheduled where we're going to go and really interrogate their venous system, looking at the veins and figuring out where is the source of the problem coming from. Because if you don't treat the source of the problem, you're never really going to get things under control. From that, again, they'll meet with the doctor, go over the results of the ultrasound. Once we come up with a plan, really everything is on autopilot. We have a full staff of people that deal with their insurance companies that get the authorization from the insurance company, so all of that should really be seamless for the patient. And then the actual procedure itself really is a very low-key, enjoyable procedure. They come in, we chat a little bit, we may give them a little bit of Valium before we start just to relax them, and typically the procedure itself is done anywhere from 20 to 30 minutes later.
Our practitioners are well educated, the staff is well educated, and they're just very caring people as well, very down to earth.
We have a large staff of heavily experienced phlebology, not just physicians, but sonographers, so we have better eyes to help support our evaluations and our treatments. And in the South, I think that we've been able to achieve not just a local, but sort of a statewide reputation for obtaining the best of care.
This practice has grown over the last 8 years dramatically. We went from a single doctor, myself sharing space in another doctor's office, to now having 3 full-time physicians, a physician assistant, 6 registered vascular technologists, as well as sclerotherapists and other ancillary staff members. So we've been very fortunate in that we've grown. I think part of that also, though, has been that we've developed a reputation within the community as being the vein center to have your problems treated, and I think it's worked well for everybody. One of the unique things about our practice also is that we have a tremendously skilled staff. These are people that really enjoy what they're doing. They're very accomplished in their work, and we really feel like the patients get the benefit of that. Thank you for taking the time to go to bestveincare.com to look us up. If you have any more questions about our practice, please click on the link.